Hello, my name's Philip Hodgkinson. I'm the Pharmacy Superintendent for MedFX Limited. So we're one of the biggest facial aesthetics suppliers in the UK, and we're looking to open up a pharmacy in Northern Ireland. So I just wanted to do this video to introduce you to facial aesthetics and some of the products that are used. So facial aesthetics is basically given the name given to all non-surgical invasive treatments. So all of the treatments don't have the stigma that's been around for plastic surgery, and they're seen as modern technological treatments, celebrity driven as well, and they don't interact with many other products, they don't interact with many other conditions, so it's seen as a very good, new, protected treatment to make people look the best they possibly can. So let's go into some of the products that are used. The first treatment products is the toxins. I guess we wouldn't be here today if it weren't for the Botox. This is the 100-unit one, and this is what started it all. It was first made in 1960 for squinting and rapid eye blinking, and they found that wherever it was injected, it got rid of lines and wrinkles. So it does that by paralysing muscles. There's been a couple of other products come along as well. The Azalor, that's the really popular one that we do because it's cheaper than Botox. And the Bocature, the unique feature of that is that it doesn't need to be kept in the fridge, whereas the other two do. So, okay, let's talk a little about the toxins. So they paralyse muscles to reduce fine lines and wrinkles. They usually last between 3 to 6 months. And let's have a look whereabouts they can be used on the face. So in the product characteristics, they recommend just using them for the upper face, but they are actually used all over the face if the patient gives the practitioner consent. They're used on the forehead for the furrow lines, for the frown lines just between the eyebrows here. They're used on crow's feet either side of the eyes. They can also be used just above the brow for a brow lift. The bottom of the face procedures, which is up to the practitioners, is the bunny lines, which is either sides of the nose, like whiskers, and they can be used for jaw grinding as well, for facial slimming, lip wrinkles just around the top of the lip there, and for face, the mouth sagging. They can also be used very successfully for excessive sweating or hyperhidrosis. Okay. So yes, they last about 3 to 6 months, and they're made up using a bit of saline. The most popular one that's used is this bacteriostatic. There's 30 mils in there. Typically a Botox will need 2.5 mils to make it up. Give it a good shake, and you're away to inject it. The injection most used is the insulin syringes. Now these have got a barrel and a needle all combined, and they've got a small enough measure to be able to measure out the amount of Botox you'll need. So you'll need only up to this 0.5 mark for most different Botox injections. You'll need a little bit more up to the 10 mark for Azalor. It's a little bit more dilute. So it's injected usually in the forehead is 5 different sites, for frown lines 3 different sites, and yeah, so it's a very popular product, very lucrative for our practitioners, and is seen as a non-stigmatized use of products. What I mean by that is people used to be conscious of having even something like their hair or their greys covered over, whereas now people say to other people, "Oh, well done, you look wonderful now." So as is such, I think the stigma of using facial aesthetics is going a bit now, and it'll soon be, "Oh, well done, you look wonderful, well done for getting your lines and your wrinkles done." Okay, so let's go into our second main category of products. It's the dermal fillers. So it's about a quarter of the uses of facial aesthetics is the fillers. Now, the main ingredient of fillers is hyaluronic acid. Hyaluronic acid is a natural component of the skin. We all have it in less or greater degrees. It's remanufactured by the body naturally, but the ability to remanufacture it decreases with age. So typically by the age of 50, it's declined by 50%. Now, hyaluronic acid is the component of the skin that makes it look supple, young, hydrated and elastic. So if you put hyaluronic acid into the skin, it gives you all of those things, and it's really quite flexible in the way that people use it. Let's go through some of the products first, and then we'll have a look at where they can be used. So the most popular products and the most long-term products has been the Juvederm range. Now there's the Ultra 2, the Ultra 3 and the Ultra 4. Now the numbers correspond to how thick the hyaluronic acid is and how elastic it is. So the 2 is the thinner one, 3 medium and 4 is quite a thick hyaluronic acid. So generally the higher the number, the deeper it is used and the more dense the product is. If you're going to use a number 4 on the surface of the skin, it go all lumpy. So that's not a good thing. So that's used quite deep, and typically that would be used just to remodel the face. So that brings us on nicely to where fillers are used. Now basically the sky's the limit really for these fillers, and it's just where you just look at an individual face, and as you can see by the lines there about where it can be used everywhere. So you can use the forehead, in between the eyes there for the crow's feet, much of what you can use the toxins for really. There's a very interesting site here, the tear trough. You'd use a very, very thin one there and a very, very experienced practitioner. So that's not a common one there. There's a product called Redensity 2 that's really good at treating that. Here we go, the cheeks. So this is the number 4, the quite deep, thick filler would be used in the cheeks to remodel the cheeks. If you've got a sallow, sunken cheek, that's really there to make you look beautiful again. Okay, and the same thing with the chin and with the jawline. Often, most nurses love injecting the lips. It's one of the most lucrative procedures. So you can either inject directly into the lips. Now, bearing in mind these are just medical devices; they're not in prescription-only medicines. You can use up to 50 injections to do your lips, so it's quite a time-consuming and aggressive treatment, one of the most aggressive treatments, but it's the most commonly used. Nurses are quite happy using that. They don't need a prescriber sometimes if they're not a prescriber, as they would to use toxins. So most people will get their lips done. That's one of their first introductions to using fillers. You can get the lines done around the lips here. There's 2 interesting lines that most wrinkled parts of the face is the nasolabial fold, which is just, I don't know whether it's showing up here. It goes down from the nose to the mouth. And then there's another line here that goes from the mouth to the chin. That's called the marionette line, if you imagine a puppet or something like that. There we go. Yes. Also, fillers can be used on hands, on the neck, the décolletage, or on the sort of area leading down to the breasts. And it can be also used to hydrate the skin all over the face. So to give it that youthful glow. So that would be something you'd use If you're getting about the age of 60, people start using that to give you a nice all-over glow, rather than going for a specific treatment and getting rid of a specific line without treating other parts of the face. So there we go. So let's just introduce some of the other products. Juvederm Ultra Smile, that's the one big product for augmenting the lips. Another big range, slightly cheaper than Juvederm, one of our favourite fillers, is the Restylane range. So that's what these look like. The Define is quite a fine lines and wrinkles product. It's quite a thin product, and yeah, let's just open this up just to show you what comes inside. So these come with your needles and your syringes. There we go, that's what that looks like inside. There we go, with a couple of needles just for use. So that's only 1 ml in there, so it's only about 20 drops. But that's enough to do, for example, a few nice little lines and wrinkles around the face. There we go. Okay, there's a nice product that's used all over the face. That's again a thin one that's used for hydrating the face. So hyaluronic acid can hold up to 2,000 times its weight in water. So that's why the skin looks so hydrated once it's been used with that. Okay, that's a really useful product. Going slightly off beam is the non-hyaluronic acid filler called Radiesse. Now this is hydroxyapatite filler. So that's naturally occurs in teeth, dentine and enamel. So it's quite a deep filler, and so that will go into the cheeks and chin again. So slightly different. Okay, so I've gone into the syringes. Let's just go into this little product now. So we're getting into the products that are used as well as the main two categories of facial aesthetics. Hyaluronidase, that is used to reverse the effects of hyaluronic acid. So if someone's got an allergy to hyaluronic acid, that will be used very, very sparingly, and because it will also, wherever it's injected, it will reduce the amount of natural hyaluronic acid, so you don't want to go too mad on that. But that's a useful tool. So that's also, let's go into that. As an adrenaline, that's also used. That's used just if someone goes into a shock after using one of the products. We do a lot of cosmeceuticals, some of which you're going to be supplying, some of which are more clinical based, and this is one here. This is a Clinicept. So that's used, that's a nice after procedure antiseptic. So that will stop people getting an infection, and typically after something like a filler or a toxin use. These are two nice little products here, Emla Cream and LMX. Now, apologies, the Emla's out of stock at the moment, but now these are local anaesthetic creams. Now they'll usually be used onto the skin half an hour before a treatment, and that will give you less ouch on the treatment. Just a couple of other things here. Oh, Fibrovane, that's a nice interesting product. That's used for spider veins, typically on the legs. And we've also got an antibiotic here, azithromycin. So that's used for stopping people getting an infection if you're prone to infection after any procedure. Okay, so that's gone through quickly a lot of the products that we use, the toxins, fillers, some cosmeceuticals, and some consumables for injecting, and also some pharmacy medicines for treatments afterwards. Okay, I'll be free any time to answer the phone at the end of the phone in MedFX, but I wish you good luck with using the products. Thank you very much.